Dr. Bhadauria, and she will be discussing about the profiling of contraindication for eye donation in a hospital corneal retrieval program in a tertiary care hospital of Uttarakhand.
Good morning everyone. Today I'll be presenting my paper on profiling of contraindication of eye donation in HCRP in a tertiary care hospital of Uttarakhand. So basically the aims of my paper was to identify the factors which act as a contraindication during eye donation in the hospital corneal retrieval program in tertiary care hospital of Dehradun and Uttarakhand. So this study was organized in Sri Mand Indresh Hospital, which was a prospective non-randomized cross-sectional study done for 18 months, and the sample size was 500. Basically, we included those patients who had any contraindication of eye donation at the time of death, as stated by Eye Bank Association of India, and the attendants were willing for eye donation, but we couldn't retrieve the cornea. So this is a table enumerating various contraindication of eye donation as per EBI guidelines. The exclusion criteria in our study was those who were willing for eye donation and had no contraindication at the time of presentation, and donors who refused eye donation at the time of examination. So basically residents were posted in various intensive care units and attended mortality calls coming from various ICU, and they evaluated the medical records and corneal status of potential donor, and if there was any contraindication, the eye donation call was avoided. So as per our results and observations, we found out that in 500 patients, the number of males were more than the number of females. As according to the distribution of age group, the age group of 61 to 80 years had the major chunk of patients as compared to 41 to 60 years of patients. As per distribution of number of cases, so the maximum cases we observed were of sepsis, followed by viral markers, and followed by viremia, but other cases are very less in number. We divided the cases of sepsis into on the basis of blood culture. One was blood culture positive, second was blood culture negative, and third was in blood culture was not sent. So we, in sepsis, so blood culture was, the maximum cases were in negative blood culture. As per viral markers, so HCV was the maximum, the cases of HCV were maximum. So in our study, the sepsis was the leading cause of rejection in 500 potential donors. As per these studies by Maya AL et al. And Venugopal KC et al. So they also demonstrated that the maximum rejection was due to sepsis. So why sepsis drafts are rejected? It is basically, there is a possibility of endophthalmitis in patients, but they have to be rejected due to guidelines. But some studies that have been done elsewhere have shown that when the corneas were transplanted from 91 septic donors, so there was no case of endophthalmitis in the recipient in the subsequent follow-ups. And in an HCRP setup, so they also evaluated the cause of rejection of tissues in the study, but they had to reject 46 corneas due to sepsis, out of which 23 were good quality tissues. And for the third study, he concluded that the only sign which conferred to active septicemia was positive blood culture. Other signs did not correlated with the active septicemia. Among viral markers, HCV was prevalent in our study. So Sharma RL et al. In the study, they also had HCV seropositivity positivity more than HbA1c or HIV. It is because due to the fact that seropositive cases that were taken from ICUs had been diagnosed with CKD or CLD. So these cases had HCV at the time of presentation. So these cases are predisposed to HCV. So if I conclude, the strength of my study it was a purely observational study which primarily focused on the profiling of contraindication. So screening guidelines have been strictly followed by all eye banks all over the country, which ensure healthy tissues to be circulated among hospitals. So as we talk to the patients and staff, so there is a chance of increased awareness about eye donation. So limitation for my study was not many studies were available exclusively to this topic. So guidelines for sepsis has not been updated by the organization, which is leading to loss of good quality tissues. So basically there was no case or control group in my studies, so the comparison would have made my study stronger, and limited evidence and research for causes of rejection in patients diagnosed with TB. Thank you.
So in part you are trying to say that sepsis cornea should not be taken, and then you said some studies have shown that it can be taken. What did your study conclude?
So basically, my study concluded that sepsis has been the leading major cause of rejection of tissues. But since we follow the guidelines only as per EBI, so there has been a loss of good quality tissues during these due to rejection and due to following these guidelines.
We should take it or we should not take it?
Sir, if there is blood culture negative, so we can take it, and if blood culture is positive, so we should definitely not take it. Ma'am, 3 days. Within 3 days. Well,